good. I knew that I wouldn't.
Time now for Morning Rounds with CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. First up, breast cancer. October is National Breast Cancer Awareness Month, and while the annual death rates from breast cancer have been on the decline, it's still the second leading cause of cancer death among women. The National Cancer Institute estimates that in 2016, more than 246,000 new cases will be diagnosed and more than 40,000 women will die. And the American Cancer Society estimates that about 2,600 men will be diagnosed as well. John, to start with, why are we seeing the decline, which is obviously a good thing?
Well, we're seeing a decline in mortality about 2% a year, and that's a stunning number. So one reason is we continue to have good surveillance and screening with mammography, and there's a contribution by breast ultrasound and also MRI, family history, figuring out people's risk factors, and we're hearing celebrities and other people and increasing people's awareness of this as a problem. But really, and I just spoke this morning to Dr. Freya Schnabel, who's the head of breast surgery for NYU Langone Medical Center, where I'm a professor. And she said she thinks a lot of the reason is our gains with metastatic breast cancer. So we have so many more tools now than we used to. And we know we can have hormonal treatment, antibody treatment, these special new chemo where you can go inside a cell and figure out the pathways outside the cell. And that's helping us with all the standard type of different groups of breast cancer there are. But with the metastatic cancer, it's almost turning it into a chronic illness. And she was so excited about this morning. She went on and on. She said, in the old days, when somebody would come in and they had metastatic cancer, you really wouldn't have that many things to give them. Now, there is so many different modalities you can offer.
Tara, next to skin cancer, breast cancer is one of the most common for women. So, I mean, how survivable is it? And how do you treat it like it's just a chronic issue?
So thankfully, it is a very survivable disease. In general, the National Cancer Institute says that 5-year survival rates are around 89%. But what it really depends on is the stage of the breast cancer, meaning the extent of disease. Has it spread beyond the breast or not? So for most cases which are localized, the 5-year survival rates are about 98%. If it is regional, meaning it's spread to lymph nodes, the survival rate drops to about 85%. And if it's metastatic, as John mentioned, then we're talking about survival rates of about 26%.
John, how is technology helping in this fight now?
Well, a lot of different ways. First of all, there's some software that can actually help people read mammography, read CAT scans, things like that. There's also some software that doctors can use to help predict what's the risk of recurrence. But the thing that really kind of blew my mind was people have to see Charlie Rose on 60 Minutes last Sunday did a piece about AI, artificial intelligence. The producer was Nicole Marks. And in the middle of it, they talk about IBM's Watson. Yes. And it's learning medicine. So it's learned how to read books, read articles. There's thousands of articles it can read a day. They come out every day. It's figuring out a way to integrate what the doctors are saying clinically. Yeah. And then it sits there at a conference. And knowing all the different types of genetic problems that can occur, each breast cancer, we're realizing, each cell is like a unique, malevolent snowflake. Mm-hmm. Everyone's unique, and it has its different genetic makeup. So how do you keep track of, what therapy is good for what? Well, it's reading this, and it's keep on learning. And it was sitting in on a conference, and the doctors would then turn to it, metaphorically, and say, so what do you think? And Watson would come up with a new suggestion for a patient, say, with advanced bladder cancer, where they've kind of run out of options. So I think in the future, this is going to be huge, because how impossible is it, right, Tara, to keep up with all the different genetic pathways? And it turns out that I get excited about this, and I know because it really is going to change everything. That if you have, that it's not just about the disease being breast cancer, colon cancer, bladder cancer, but the genetic molecular pathways that have gone wrong. And a computer can say, well, wait a second, the genetic problem that's occurring in this ovarian cancer is the same as in that breast cancer. And this therapy worked for the ovarian cancer. Let's try it on the breast cancer. Right. Wow.
So then how does that change screening, Tara?
So breast cancer screening in this country has saved thousands of women's lives. And we talked about screening last week with prostate cancer, but the idea is to pick up the cancers early when they're localized. And so each society has different recommendations. The American Cancer Society in general says that starting at the age of 40, women can have the choice to begin yearly mammograms. When they reach 45 to 54, they should get a yearly mammogram. And once they're over 55, they can switch to every 2 years, or they have the choice to continue continue it every 1 year with a mammogram. Now, this is if a woman is of good health and has, in general, an over 10-year life expectancy. Now, this is for women at average risk. If a woman is high risk, for instance, she has the BRCA1 or 2 gene, then the screening guidelines are a little bit different. The American Cancer Society says that they should start at age 30, and it should be with MRI as well as mammogram.
Be a bit more vigilant. I want to ask you all as well about something else in the news. We are seeing a lot of health threats because of these hurricanes and flooding. Last week, Hurricane Matthew devastated Haiti and other Caribbean countries, and it's caused some havoc in the United States, particularly in the southeast. At least 39 people have died in 5 coastal states, most of them in North Carolina, where record flooding has continued all week, posing significant health risks for residents there. So what kind of health risks are we talking about?
Yeah, you would hope that the worst is over when the storm happens, but in many cases it's not. So there are different types of health risks. There are infectious disease risks that can come. So for instance, diarrheal illness if you eat or drink contaminated water. You can have wound or rash infections from standing in floodwaters. You can also have mold, which can grow in homes or businesses that may be filled with moisture or standing water. You can also have injuries, so electrical injuries from downed power lines, chemical hazards or injuries from chemicals that may have gotten moved in the flood, wounds from pieces of wood or glass, as well as drowning injuries. And then one that people don't often think about, which is carbon monoxide poisoning. A lot of people use generators when the power is out, and if you don't use it appropriately, that can push you at risk for carbon monoxide.
Jon, Tara talked about standing water. Mosquitoes obviously breed in standing water. Is that part of the risk here too?
Yeah, well, I checked this out with the CDC this morning, and they said that initially what can happen with these hurricanes is you can wash out the adult mosquitoes and the larvae. So actually it can go down initially, but then the big question is what happens afterwards as the water starts to show up in little pockets. And of course we know with the Aedes aegypti where it contains the Zika virus, it can breed in a little bit of a thimbleful of water. So that's a problem there. And then you also have the destruction of houses. So if the screens are out, that's going to increase the risk of having mosquitoes. And, Margaret, you mentioned Haiti. It's just heartbreaking. Tara, you talked about cholera. They're wondering about it there. They're watching for it there. Of course, they have Zika. So, I mean, how much can one country, one nation take?
No, I know.
Finally, something most of us take for granted, the sensation of touching. 28-year-old Nathan Copeland is paralyzed, so being able to sense touch is no small matter. Researchers at the University of Pittsburgh implanted electrodes in Copeland's brain. When a specific part of his brain was stimulated by a machine, he was able to feel sensation in his hand. Then, using a prosthetic limb, Copeland could correctly identify which prosthetic finger was touched 84% of the time, even while blindfolded. Thursday, Copeland met President Obama at the White House Frontiers Conference in Pittsburgh, and using his mind-controlled robotic hand, exchanged a fist bump with the president.
Very cool.
Sure.
No words.
Amazing.
Yeah, extraordinary. All right, Doctors Jon LaPook and Tara Narula, thank you both very much for being here this morning.